2 weeks after India banned the export of hydroxychloroquine and formulations made from the medication amid the coronavirus pandemic, the government has now lifted its ban for some countries which are badly affected. The decision came after US President Donald Trump hinted at a possible retaliation if India doesn't lift the ban on its export. In the view of the humanitarian aspects of the pandemic, it has been decided that India would license paracetamol and hydroxychloroquine in appropriate quantities to all neighboring countries who are dependent on our capabilities. We will also be supplying these essential drugs to some nations who have been particularly badly affected by the pandemic, the government said. With more than 360,000 confirmed coronavirus cases and close to 10,000 deaths, United States is arguably the worst affected country. US President Donald Trump has repeatedly said that hydroxychloroquine could be a game changer in its fight against the pandemic. But what exactly is hydroxychloroquine? Hydroxychloroquine is an oral drug used in the treatment of autoimmune diseases such as rheumatoid arthritis. A study in China reported that chloroquine treatment of coronavirus patients had clinical and virological benefit versus a comparison group, and chloroquine was added as a recommended antiviral for treatment of coronavirus patients. Based upon limited intro vitro and anecdotal data, chloroquine and hydroxychloroquine are currently recommended for treatment of hospitalized coronavirus patients in several countries. Hydroxychloroquine should not be confused with chloroquine, which is an anti-malaria drug. Is it being used in India? The National Task Force for Coronavirus has recommended hydroxychloroquine for preventive treatment in case of asymptomatic healthcare workers involved in care of suspected cases of coronavirus and asymptomatic household contacts of laboratory confirmed cases. However, experts have clearly cautioned against its excessive use. Only doctors and healthcare workers have been advised to use hydroxychloroquine. Should the general public buy the drug? No. If one developed COVID-19 infection, he should visit a doctor. As per the government guidelines, hydroxychloroquine can be taken by a patient only if it has been prescribed by a registered medical practitioner. No one should self-medicate. Is hydroxychloroquine the anti-COVID-19 drug? Clearly it is not. Hydroxychloroquine is currently under investigation in clinical trials for pre-exposure or post-exposure preventive treatment of SARS-CoV-2 infection and treatment of patients with mild, moderate and severe coronavirus. At present, there are no drugs or vaccines for the treatment of coronavirus.